Today we are going to talk about basics of ultrasound in pediatric intensive care unit. Now, we all are aware that in last decade, the most important progression in healthcare advances for critical care is usage of ultrasound. Ultrasound generate non-invasive imaging and it is performed by using high frequency sound waves to create real-time images of internal organs or other soft tissues. Point of care ultrasound is gaining popularity and it is an adjunct to clinical examination for assessment of deranged physiology. It is also being used to guide treatment and make life-saving critical decisions immediately as soon as we receive child in ER. When we use ultrasound in pediatric intensive care unit or in pediatric emergency, it is usually done for three important reasons. First of all, it is rapid and at bedside we can do it. It gives us very helpful clues in managing the child. These dynamic images which are generated by ultrasound, they help us in correlating with the clinical picture. Most often our examination findings, if are backed up by having a real-time image of what is happening, it reinforces our thought process and reinforces our therapeutic intervention. When we deal with ultrasound, there are two important set of conditions where we generally utilize them. First is for therapeutic or procedural, second is for diagnostic. So when we do procedural ultrasonography, we usually do it to evaluate heart status, to evaluate IVC status, to do a transcranial Doppler in case we want to see how bad is the circulation in brain, to check how is the status of lung and pleura, to evaluate movement of diaphragm, and to assess optic nerve sheath diameter in case of subarachnoid hemorrhages. So when we are in a state where as clinician we are tied up, we obtain relevant help from ultrasound, and also these ultrasound helps us in putting lines, helping us nowadays even to put a peripheral cannula. Thus, one of the most important use in clinical practice is to obtain a vascular access. Securing central and peripheral cannulas under vision is less traumatic, more useful, more user friendly, more patient friendly. Attempts of cannulations are less if it is done under ultrasound guided. Lower failure rates helps in improving confidence of patient in doctor as well. When we are aspirating pleural tap, when we are doing pleural tap, or for that matter of a pericardial tap or ascitic tap or deep seated abscess, aspiration is done with a better yield when we do it under ultrasound. Even after intubation, to confirm the position of the ET tube, ultrasound are very useful. No need for an emergency x-ray if your confidence is more and you can identify that your end of ET tube is at the right position, and it is very helpful if at all ET tube is not being positioned well and you are dealing with a difficult airway. Even ultrasound are very helpful in identification of cricothyroid membrane, and thus a surgical crick is also done in emergency purposes. When we use ultrasound to evaluate heart, it is useful to tell us what is the ejection fraction, how is morphology of the heart, is there any aberrant connection, how is the PA pressure, how bad are the valves affected, if at all there is any vegetation in the valve. There are four important views which are associated with while we are evaluating for heart and its function during point of care echocardiography. These four views are subcostal view, parasternal long axis view, parasternal short axis view, and apical four chamber view. This image tells you about how a parasternal long axis view looks like, and whenever you are putting the probe, it is important for you to understand that parasternal or apical or subcostal, all these views are going to give information of one specific site in one of the frame. So you should be able to mobilize your probe in a way that you get to understand how the entire chamber is functioning. That will give you a better understanding of what all you have to do, so that you have to make a decision and you can make it wisely by looking at the entire organ and the muscle involved in that view. Do not just put the probe and decide after looking at the first image. Always probe it better and use that information to decide.